Hello and welcome to Patient World. Today we are so honored to have our special guest, and I want him to start by introducing himself.
Well, good morning, and thank you, Doctor, for having me. I'm honored. My name is Lee Tomlinson, although my audiences often call me Patient Lee. I am a lifelong inhabitant of hospitals and medical centers around the world due to an addiction to adrenaline. And I have to say, I've broken over a dozen bones, some as many as 3 times due to that addiction. I've had my thumb pulled off. I've had skin grafts, bone grafts, more infections and infectious diseases than you can imagine, and stage 3, stage 4 throat cancer. Through that lifetime of medical interventions, I have obviously been treated with tremendous competence. I mean, I'm still alive, which, honest to God, is a miracle. So I thank people like you for that. And also tremendously kind and compassionate healthcare professionals as well, which the only time I didn't was at the very end of my cancer treatment when I was hanging on by a thread. I had stage 3, stage 4 throat cancer. 3 months of chemo followed by 35 straight days of radiation and 35 atomic blasts to the base of your tongue, which is where my tumor was. I thought I was tough, given all of those medical interventions and accidents and bones and surgeries. This was all of those times 1,000 in terms of pain. Imagine a cherry bomb going off in your throat on Monday. And then on Tuesday, you get another one off. And then Wednesday, another one. And I did that for 35 straight days. I couldn't eat. I couldn't speak. I literally was hanging on by a thread and living in 15-minute increments. Can I make it from 1:15 to 1:30? And then I found myself hospitalized, unconscious in an ER with an unidentifiable septic infection at the site of my port. Great. So now I'm dying of cancer. And now I've got an infection that immediately is more dangerous than the cancer. If ever there was a time that I could have used some kindness, caring, compassion, politeness, it was then. And I got zero. These are the rudest, most insensitive, unkind, uncaring doctors, nurses, phlebotomists, maintenance, food services I'd ever met. And it made me suicidal. You know, I decided that I was going to end my life. And if these people in whose hands I put my life don't care about me as a human, then they must know that I'm not worth it and that I should get off the earth. And I had enough fentanyl patches and would have done that if it hadn't been for a very short conversation with a doctor pal who came to visit. And I knew him well. He was a good friend. I knew him well if I was going to ask him how many patches to put on so it didn't look like suicide, so I could leave my family this huge life insurance policy at the movie studio we owned. And he did some amazing things. He very politely touched my arm, bowed his head, and apologized to me for what he said was the lack of compassion I had experienced. And he apologized profusely and then said, "It's happening everywhere, Lee. It's not just you. I'm so sorry for you. But it's becoming even worse in healthcare. Compassion is going away." He said, "Can I make a suggestion?" He asked my permission. How kind is that? I said, "Sure, Dean." His name was Dr. Dean Adele. And he said, "How about this? How about you fight? And if you live, how about you devote your life to seeing if you can reverse this disappearance of compassion in healthcare and become part of the solution rather than evidence of the problem?" And that's what caused me to form the Compassion Heals movement. to do exactly that. And since I recovered my voice and survived, thanks God, I've delivered over 200 keynotes around the world to every imaginable kind of healthcare professional to remind them that they didn't made an agreement when they got their degrees to be equally competent and compassionate and to stay healthy enough and unburned out to do it. So that's me. That's what I'm up to. And I got to say, life is good.
Wow. I'm just kind of speechless. Give me a moment here.
Well,
That is an incredible story. And I thank you so much for sharing it. And the fact that you are sharing it, that means a great deal. And that should be inspiring to healthcare providers who have to stop and think, am I like that? Do I make people get to the point of feeling suicidal? Have I lost the compassion that called me into medicine in the first place?
exactly.
And for patients who have gone through the ringer dealing with their conditions, it should give them hope and should inspire them. And I love what you're doing. Tell us more, please.
Well, it's been a journey, I must tell you. It's such I mean, imagine this. So so he says, why don't you start a movement or something? Great. Now you understand, I'm, dying of cancer, dying of an infection. Prior to my diagnosis, I didn't know it, but I had every single symptom of burnout imaginable. In the crash of '08, just before the crash of '08, I discovered that two of my business partners were embezzling money, millions of dollars out of the company. And when I confronted them with it and came to work the next morning, they had locked me off the studio lot, stopped paying me. I had to spend 2 years in litigation. They won that one easily. Then Lehman Brothers sued me to get what I had gotten from them for a nickel versus the dollar it was worth. Spent another 2 years in litigation, and then Lehman Brothers went bankrupt. So now I'm all of a sudden 4 years without income. Hadn't worked in 4 years, so I was kind of out of the industry. Ran up about $500,000 worth of legal fees, and not having any idea what I was going to do. So I was working my tush off to bring everything back to normal in my life. And literally, I was killing myself, I was killing my family, I was killing my relationship. And then I got diagnosed with stage 3, stage 4 throat cancer. Now, you know the science. Is there a tie between immense unmanaged stress and illness? Yes. We both know the answer is yes. And burnout among healthcare providers, which renders them unable to be fully competent or compassionate, is a crisis it's a crisis unlike we've ever seen before in healthcare. And literally 63% of doctors are reporting symptoms of burnout, which means they're not competent or compassionate. 63%. The number is higher with nurses. So it is an epidemic, a crisis that we must deal with. Burnout among healthcare providers, ladies and gentlemen. If your provider and staff are burned out, you are not going to get the competent and compassionate treatment that you expect and deserve. So you have to be very, 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 very careful when you choose your physicians and their staffs, hospitals, organizations, to make sure, first and foremost, are they compassionate? Are they kind? Are they caring? Do you feel seen, heard, and appreciated? If you don't, look somewhere else, because you must have both for you to have the best outcome for whatever reason it is that you're seeing those physicians. So that's what I learned. And if I'm always a patient, if I were a new patient and I had a serious illness and I didn't have a doctor and I was looking for one, I would first, because you're not going to really know so much about how competent they are. I mean, what do I know about judging a surgeon or an oncologist? I haven't a clue. But, are they kind? Are they caring? Are they polite? Do they attend to you as a living, breathing human being, or just patient 27 at my 9th hour of rounds? And if they do, I'd much rather have given the training that physicians have, I'd rather have the 100th, the 100th, how do I say it? 100th, the doctor who's the 100th most competent, but the most compassionate, I would take over the doctor that is the most skilled, but has no compassion in a second. And then it's critical.
So one very sad fact is we're looking at a potentially catastrophic shortage of physicians
and nurses.
Oh yeah, the nursing, that's another huge can of worms. But
yep,
it's been predicted by I think 2034 there will be short maybe 124,000 physicians in this country.
Yep.
So the amount of time that patients will have with the physicians there's a huge potential for that to take. Nurses are also leaving the profession.
Yep.
For so many reasons. There have been studies really addressing that. Yep. And quite frankly, I'm concerned about where we are going in healthcare with doctors and nurses. It's like an exodus from the field. Yes. And when more people leave, those who are left have to see more people, which means they're going to be more stressed, which means it's going to be more difficult to be compassionate.
Yep.
And this huge spiral, it's extremely, it's alarming and concerning. And I'm not sure where we go from here. One thing, that I advocate for is, know your symptoms, know how to prepare for visits. So ideally, you will get the most compassionate person possible. But as we look toward not having enough doctors, and doctors are just putting people into slots that don't exist,
right?
To try to give people as much care as possible, realizing they're overtaxing themselves, but they just want to get that extra person in who's suffering. Maybe I can do something, but they may not have 15 minutes face to face. They may just have 2 or 3 minutes to do the most good they can do in that time. We are potentially headed toward that situation. And so it's really important for people to be prepared, no matter what they see on the other side of the examining room table, do all that they can do to optimize their outcomes.
Yeah, I mean, that's the cool thing about your book, which is brilliant. Look, if you can walk into your first meeting with a doctor, assuming whether what you got symptoms, but you don't know what's coming. If you've got that information and you've got it there available in your hand about the symptoms, about the medicine you take, about your history, about all of that stuff, so that they can instantly, after they shake your hand, they learn your name, they offer you a chair. After all of that, you have dramatically sped up the process.
Exactly.
And you've got to be responsible. They're going to do their job, but you need to be responsible from your side to do your homework, because it works both ways. So your book is brilliant in giving people the very specific information that they ought to take into any first meeting with any doctor for anything. So, listeners, buy the book. I promise you, you're not that prepared, and you ought to be, and now you can be, by buying the Good Doctor's book. And I get nothing for saying this. It's just true. I bought it myself. So read it.
Appreciate your words.
Brilliant. Why in the world? Why in the world doctors don't send that out when you set an appointment? I have no idea, but they don't send a copy of your book.
That's so kind. The book is Patient Empowerment 101, More Than a Book, It's an Adventure.
Yep.
So now I want to talk about your book. Tell us about the book you wrote.
Well, I've written a number. The latest one is called Compassion Heals, From Self-Care to Healthcare. And it's primarily written for healthcare professionals to help them remember the kind, compassionate, loving human beings they were when they first decided to become a physician or a nurse. And then to talk about the science that proves that compassion is not an option for the best outcomes for patients. It is an absolute necessity. There's a book out. Yes, I'd love to have you buy mine. But however, if you want to know the science of compassion and whether or not it's a nice thing to do or in fact has true significant medical benefits, it's a book called Compassionomics. Compassionomics. Two research scientists, ER doctors as well, one day decided that once and for all, they wanted to know whether or not compassion was an option or a necessity. So they spent 2.5 years studying every study on the face of the planet, thinking when they went in that providing compassion for patients is nice if you have the time, but not a necessity. They came out 2.5 years later after massive study with the very simple fact that providing compassion is not an option. It is an absolute necessity for the best, quickest outcomes and long-term health, not only for their patients, but for themselves. So it literally is an absolute necessity that it be given and that we get it as patients. So my book talks about all of those things and then tells the story of my life in healthcare, how I came to start the Compassion Heals movement, and my mission to communicate that necessity of being competent and compassionate, as they were when they graduated from med school, or at least when they started med school, and to encourage them to practice the self-care necessary to not burn out so they can be that compassionate being. You people are my gods and goddesses, and I'm alive today because of people like you. I'm in absolute awe. If there's one sick person left on the face of the planet, you're going to take care of them, even when you're suffering, and you'll do more. And unfortunately, there's never an ending to patients. So we need to, as patients, we need to be kind, caring, and compassionate with our healthcare professionals so that they can feel seen, heard, and appreciated by us.
Mhm.
And so they will take the time to do whatever it is to practice self-care so they can remain healthy enough to be that compassionate and competent person they were at the very beginning. So that's really what my book about. It is meant to inspire healthcare professionals to take care of yourselves first. Be healthy, be present, then take care of us. Put your needs first. As someone once said, patience comes second. Yeah, we should. Not when we're in the room with you, but every other day so you can take care of yourself. Put you first, get healthy, then worry about us.
So
That's what my book is about.
first of all, I'm very much enjoying reading your book, and I think that healthcare professionals do need to read it, because even from the very beginning, when you started talking about your feelings, what you were going through, the things that happened, I've seen situations similar to that, and most doctors
Sure.
have. And
Of course.
it's beautiful to hear it from the side of the patient, what the patient endured. It's not just, okay, the doctor's busy, we've got a ton of things to do, but how do you make that person feel? And what impact does your body language, do your work,
Yes.
all those things have on that person?
Yes.
And I also, I think about whenever I get on a plane and the stewardess says, put your mask on first. If you are getting ready to pass out because your oxygen is low, how are you going to help somebody sitting next to you? So that
Bingo.
was an excellent thought that you had as far as doctors and healthcare professionals. They need to take care of themselves, because if you're wounded, how are you going to run a race? Particularly when times get hard, you don't have the energy left, then you're going to burn out, or it's going to show.
Yep.
So where can people get your book?
Well, the easiest place is to get it on Amazon. Compassion Heals, from self-care to healthcare. Amazon, go ahead, grab it there. You can also go to www.lee, L-E-E, Tomlinson, TOMLINSON.com, and scroll down the first page. And there's what we call the Compassion Heals Challenge. It's 7 days. I agree that I'm going to put some compassion, one kind act a day. I'm going to open the door for somebody I don't know. I'm going to nod at a stranger, something small. One kind act a day for 7 days. At the end of it, when you complete it, if you take the challenge and put some kindness into the world intentionally, I'll send you a copy of the book for free. So you can buy it. That's great, on Amazon, or you can go to my website, www.leetomlinson.com, scroll down to the Compassion Heals Challenge, sign up. We'll remind you for 7 days. And if you're suffering, then give those kind acts to yourself. If you're burned out, if you're exhausted, be kind to yourself. If you're in good shape, be kind to others, and you both will be healed. That's one of the miraculous things about compassion. Imagine this: for every kind act that I give to someone else, they get all of those benefits that science has revealed. Faster healing, less pain, all of that stuff, because everybody's hurting every minute of every day. We sometimes hide it, but we're all hurting. But here's the miraculous part: the giver of compassion gets the exact same benefits as the receiver. That's pretty cool. I mean, how many times, if you give somebody a gift on their birthday, that's great for them, but what does it do for you? No, you do a gift of kindness and compassion, and you feel better for it as well. The gift that keeps on giving. That's pretty cool.
Lee, if the world had 100 more people like you, it would be 1,000 better. I
Well,
love your heart.
Thank you. That's one of the kindest things anybody's ever said. So I love what I do. It allows me to express my deep gratitude and maybe help people like you who've saved my life more times than I can remember. Maybe I can help you improve your life just a little bit as my way of saying thank you. I love you.
Well, thank you so very much for coming on the show. At the end of the video, I'm going to post your website information as well as the book.
Good.
So thank you so much. Keep on doing the tremendous work that you do.
I promise. You and me together.
Okay,
Thank you
sounds
for
good.
having me. Thank you.
Have a blessed day. Bye-bye.